Our next speaker is Pat Geraghty, Chairman and CEO of GuideWell and Florida Blue. He leads a family of forward-thinking companies, including the state's largest health plan, serving 7 million people in Florida and providing Medicare payment services to 12 other states. Pat is leading the transformation of Florida Blue from an insurance company to a wellness company with a strong focus on health, wellness, and prevention. He is reorienting the company around the consumer to improve quality and value. He also serves as NIHCM's chairman. Pat.
Are we working on this now? All right. Very good. Thank you, everyone. Thank you, Nancy, and thank you to the NIHCM Foundation for putting this forum together. Andrew's done an outstanding job of talking to you about payment reform. I'm going to spend a little bit of time talking about how payment reform falls into the broader picture of changing the health and healthcare system in the country. Because if we step back for a moment, someone who's in a position like mine, you look at the question that was in front of us as a nation, and I don't believe it's a political statement. I actually believe it's something that we're passionate about and follow every day, that all Americans should be covered. I don't think that's a political statement. I think that is a statement of where we should be as a country. How we get there is where the debate comes to be. But when we were at the beginning of this healthcare reform discussion, we were talking about reforming the delivery system, reforming how patients access care, reforming insurance. And the debate got narrower as the discussion moved forward because of a lot of political factors. But let me take you back to that broader picture, if you will. Our company, as you just heard, is a $12 billion operation. We're handling people in Florida, but we're also doing Medicare payments across 12 other states. That gives us $108 billion of Medicare payments in that business unit alone. So we have a tremendous amount of data that we look at to understand what's actually happening in the system. As we structured our organization, GuideWell is at the top. That's the holding company for 4 principal organizations. The insurance entity is Florida Blue, the Blue Cross Blue Shield company in the state of Florida. But we've created 3 other organizations. One is called GuideWell Health. That is where we do our direct delivery of healthcare, and we own a variety of healthcare assets, and I'll talk about those in a moment. GuideWell Connect is where we do our retail business, so focused on the consumer. Think about how we have delivered healthcare in our nation. It really has been about sickness, and it's been about the delivery system, because the convenience in our system was the convenience to a doctor or a hospital or somebody other than the patient. And we're big about how do we transform the system to be responsive to the patient and customer. And then GuideWell Source is our 12 states that we handle Medicare payments in. So that's how our company is structured. What we look at is where we've been, sort of the old world of healthcare, and the principal piece in the old world is fee-for-service medicine. Perfectly designed for volume. The more you do, the more you get, and that's the system we generated in our country. Therefore, we have much overuse and a lot of spend that is unnecessary. Today, the new world where we currently operate is with much more payment alignment, as Andrew was talking about, and a system that is really focused on how do we utilize the data that we have, how do we utilize the technology that's come to bear, and we look towards the future world where we're truly integrated with partners, and we start to spend more time on what should one organization do versus another, because there's a lot of redundant activity that happens in the system today. And how do we really focus on population health? And so less about the payment model on a day-to-day transaction basis and more about how do we work together to utilize data to drive for better results for the people that we serve. So we think about this in a much more holistic way, thinking about how do you use data, how do we use the technology that comes to bear to drive through accountable organizations. And we've got a variety of those that we will talk about across the state of Florida. I came to Florida from Minnesota, so I understand how we could focus in Minnesota around the Twin Cities and deliver for most of the people we were covering. Florida is a whole different other story. If you know anything about Florida, you know that Miami and Jacksonville are in two different universes, right? You know that Tampa and Orlando are very different places, and the Panhandle altogether different. So we have at least 5 regions that don't act like each other, that have very different ethnic makeups, that have different histories and different delivery systems on the ground, which means that we have to be very sensitive to the geographic needs, to the cultural needs, to the backgrounds and what our customers expect. And so our delivery model varies all over the state depending upon where we're delivering that service. And so we'll talk about that. And this depiction gives you sort of the generation of different things that we're thinking about, how to deploy data, how to use virtual care, right? So when people talk about virtual care, they talk about televisits. And how do you do a televisit? Well, in a fee-for-service world, a televisit could mean that somebody who is the worried well could spend a lot of visits just because they now have access through the telephone to call that provider, right? So you really have to be in the new world of payment reform in order for that televisit to make sense. Because for all of us to create efficiency, the televisit needs to replace the visit in the office. That only became created in the office because of why? Because historically, that's where the provider got paid. Therefore, when you wanted any service, you came to the office, right? And when we talk about this in our marketplace, we say, think about where our kids are going to be. We had the privilege of going to a doctor's office to wait, going into an exam room to wait, seeing the nurse first to wait, maybe having that really comfortable smock on that you get to sit on the cold table with, and then finally getting to see the physician, only to get then a written prescription that you have to then go to the pharmacy to wait. Our kids aren't going to accept that. The next generation isn't going to accept that because everything happens on your smartphone. So why should the medicine be any different, right? So we talk about the fact that most medical visits are going to happen on the phone, looking at the doctor with your finger plugged into a device you've plugged into your smartphone, which transmits your vitals. And you have the visit, and then you go to the electronically transmitted pharmaceutical prescription that you will then pick up at your convenience because the system is now built around you, not built around the delivery system. And more visits are going to happen that way, and they're going to happen that way quickly. When we look at Florida, so I'm talking about all the different regions of the state and how we've designed things in each one of those regions. We have literally multiple pilots going on in the same geography with different intent. Because the system is so large and so fragmented today, it's not going to consolidate overnight. It's going to consolidate in steps. So we've built primary care alignments. We've built ACOs with hospitals. We've built intermediary levels of care. And I'm going to show you some of those as we move forward. But we've looked at a variety of ways to deliver care. First example I'm going to point to is what we call the Clinician Ethos model, which is Clinician. This is a firm out of South America. We believe it's the first time a U.S. company contracted with a non-U.S. firm to deliver health care in the U.S. So think about what I have in South Florida. Increasingly, more and more people from South America that have landed on our shores and live in South Florida. Sanitas, one of the brands of healthcare that they know very, very well, is out of South America. We contracted with them to partner with us to deliver medical clinics in South Florida. We built 3, we're building 7 more over the next 18 months. Culturally significant and sensitive care in the communities. The first community we built this model in has 80% Hispanic population around the clinic. Everyone in this clinic speaks Spanish. It is a clinic that's built with the understanding that the family matters greatly in that culture, and often the family comes to the clinic together. So we've built waiting areas that anticipate that. We've built one-stop shopping in this clinic. So think about primary care, think about emergent care, Think about getting the mammograms or MRI or some of the specialty services all in one place, because from South America, they're used to being able to get all of their care in one place. And by the way, our view of this was there's a lot of people who are from other cultures that would like the idea of one-stop shopping where you could get all those medical services aligned in a single place. Their goal in setting up this clinic, and they deliver to this in South America, is you see the doctor in 15 minutes from when you enter the site. And if you need follow-on care, we try to get that done immediately following your first visit. So this is dramatically different care, and it's built around satisfying who? The member, the patient, right? And so it's a different way of thinking about care. We're very excited about those clinics, and they've been warmly received in the South Florida marketplace. The next example I'll show you is GuideWell Emergency Medical. Now, why would we go into emergency medical? Well, if you go and look at an emergency room, is that the place you really want to get your care? I mean, honestly, if you look at the way emergency rooms are operated, they are not built around the patient. They do not deliver for the patient. And so we created emergency medical care. We built it right across the street from a hospital. Why? Because that hospital was admitting multiples of the number of people who should have been admitted to the hospital following their emergency room visits. Many hospitals consider the emergency room the front door to the hospital, and it's a way to fill those beds. In fact, many people shouldn't be filling those beds. They should get the care they need. They should get it quickly. They should get it with high quality, and they should be going home. So we created this facility to do just that. And again, it's resonating. The patients that have come through here have said, wow, quality of care, well delivered, quickly delivered, and I'm satisfied with what I'm getting. So we're disrupting what the hospitals are doing by putting these facilities in place. And there's some intention in that. Alignment Healthcare. This is an organization, if you follow what's happened in Medicare, there was an organization called CareMore who did a very, very good outreach model to chronic care patients in the Medicare world. They sold their organization, and the CareMore 2.0, if you will, is Alignment Healthcare. We've created contracts with them in Florida in 6 locations to take care of our chronically ill patients in concert with primary care physicians. So if you're running a primary care practice and now you've got chronically ill seniors, you work in concert with the folks from Alignment Healthcare because of the intensity, because of the particular needs that a chronically ill senior needs. And these folks are very, very oriented to that, and it's a partnership model. And so we're going to be doing a better and better job for our seniors through this particular model. When we look at the size of the state of Florida, I mean, we're headed dramatically fast towards being a 20 million population in our state. We're already the 3rd largest state in the nation, and our senior population is the fastest growing population we have. So we have to do more than the things that we own, and we do that through having patient-centered medical homes. We have 3,000 physicians in patient-centered medical homes. We have 700,000 of our patients who are today being taken care of in an alternative care model. So we are dramatically on the path to the targets that Patrick Conway laid out just a short while ago. And I'm now trying to advance, and there we go. Take me to the next slide, please, if you wouldn't mind. So, retail centers. Think about what you've thought of an insurance plan or an insurance company, and I want to turn that on its head. So for a minute, suspend how you think about an insurance company. What we've said is we're going to take an insurance company and make it a health solutions company. And one of our calling cards for that transformation is our retail centers. Look at this facility. We have 18 of these across the state of Florida now. So what happens in one of these retail centers? And think about the Affordable Care Act coming at the same time. You can walk in and you can buy individual insurance. We have somebody there who will counsel you through that process. But you can also walk in with your claim that hasn't been resolved the way you think it should, and we will resolve it face-to-face with the customer. People say insurance companies are hard to get a hold of on the telephone, or they hide behind things. We've put ourselves on the front line. You can walk in and we'll resolve it for you face-to-face. We'll teach you how to use our online tools. Because guess what? People push out apps and assume that the customer is going to know how to use those apps. What we found is even some pretty sophisticated people come in and go, oh, could you teach me how to use the app? Yeah. And we'll walk you through how to use the online app, an app like Know Before You Go. So before you receive a service, you can go online on our Know Before You Go app, see what the service costs, know what's going to be covered, and know what your piece of the expense is going to be. One of the great questions that members ask us all the time, I want to know in advance what my responsibility is going to be. You can do that. In our plan, we teach you how to do that. The third element here is care consultants. So we have nurses who will build a tailored health and wellness program to you, the individual. And they do that through consultation with you about lifestyle and about the things that you ought to be emphasizing in your personal program. So any one of those entities can be used. What's happened for us? Last year, we had 350,000 unique member visits to Retail Center, right? Before, an insurance company is big building on a skyline that you didn't go into, only their employees did, and it was a mystery. Now we're engaging our members each and every day in our retail centers. Our customer satisfaction in a retail center, 92%. Is that the number you think about when you think about your insurance company? When you go to our care consultants, 97% customer satisfaction. Therefore, last year, our plan received the Blue Cross Blue Shield Association award for the highest member retention level in the nation, because our customers either have encountered us face-to-face, know someone who's encountered us face-to-face, or know that they can, and it makes a difference. So we've personalized what we do. The other thing we do at these retail centers is we talk to the mayors and the civic leaders in each one of these communities where we open one and say, what would you like this center to be to serve your community? In Orlando, we do a reading program. We literally do a literacy program with inner city schools. Kids come with their parents and teachers. They leave with a backpack full of books. They engage the Orlando Magic basketball players, and we call it Baskets for Books program. And the Magic have to score a little bit more in the next season, but that's another issue on the side. But these kids leave having had fun, having engaged us in a fun environment, and having seen heroes of theirs read to them, and then the kids read back. Because literacy and health status in life, intimately linked. So this is a critical element to us thinking about ourselves as a health solutions company, not just an insurance company. Yes, there are financial models. Yes, there are benefit designs. Yes, there's an administrative focus. All of that captured on this slide. But health is much bigger than health care. It's much bigger than fixing people on the back end of the process. It's being engaged with people proactively, thinking about wellness and thinking about staying healthy in the first place. And some of the things that drive that are literacy, are the ability to live in a safe neighborhood, ability to go to a school that has a gym program. We advocate for all of those kinds of things because our mission in health is much, much broader than just thinking about a claim payment on the back end of the process. To that end, we've been a partner in what's called Lake Nona, which is just outside of Orlando. The Lake Nona Institute founding partners were Johnson & Johnson, Wellness and Prevention Division, GE's Medical Division, Florida Blue GuideWell, and Cisco. We were the founding partners to this institute, if you would. This institute now will have the GuideWell Innovation Center, which we are building currently and which will open next spring. That Innovation Center will be focused on the following things: incubating new technologies, new companies who will impact the health and health services world, giving them mentors, giving them an ability to work collaboratively, giving them a campus for them to actually advance their companies faster to the marketplace, and also convening discussions around the critical issues in healthcare, like how do we solve our primary care shortage? We all know that integrated teams can make that happen, but what are the best models, and how do we bring people together to discuss that? And one of the things we know is that when we go to Tallahassee to talk to legislators, They have a huge agenda, as you know from all of the people you work with. And how can they possibly know enough about some of these health issues? And what we'll be doing is, as we convene these forums, we'll be bringing legislators from Tallahassee to the forums to learn about the issues in greater detail so they can be a more informed legislator. So we see our mission as broad, much bigger than an insurance company paying a claim on the back end of the process, a huge stakeholder in driving the system to change, to quality, and to innovation. Thank you.